Dear students, welcome to EPT Pathsala. I am Dr. U. Zarina B., Professor, Dean, Faculty of Business Administration, Avinash Institute for Home Science and Higher Education for Women. In this session, you are going to learn about management purviews of dietary department. What is dietary department? It may be defined as any meal prepared outside the home. This includes restaurant, school, and hospital cafeterias, catering operations, and many other formats. Dietary department management or administration covers day-to-day operations of restaurants, hospitals, and related establishments that serve foods. The provision of high-quality nutrition services by the Dietary Services Department is an essential and integral part of the function of the Dietary Department. Quality of food need to be closely and continuously monitored. The essential components of nutrition care are interpretation of the diet prescription, nutritional status, implementation of nutrition care plan, evaluation, understanding, and discharge planning. What is management in dietary department? Management in dietary department predominantly in hospitals, healthcare facility, hotel industry plays a pivotal role right from planning and executing the daily operations and manpower support. It enforces organizational policies, direct facility operations, and serve as the main liaison between the dietary department and the management. Arranging of adequate training on the latest technology development in maintaining of documents, providing data for use in research and education, ensuring trust of safe environment to the stakeholders and to the employees is the prime responsibility of the management in dietary department. This module will include 1. Management functions of dietary department, 2. Skills and abilities of dietary managers, 3. Organization structure in dietary department, 4. Financial planning in dietary department, 5. Management activities in dietary department, 6. Human resource functions in dietary operations, and 7. Revenue management operations. After completing this module, you will be able to know the various functions of dietary department. To understand the skills and abilities of dietary management in dietary department, to acquire the knowledge of organization structure, financial planning, and activities of dietary department, to determine the human resource functions and revenue management in dietary operations. This module is part of the course Food and Nutrition. Management purviews of dietary department. Management is often regarded as the responsibilities and challenges that have to do with being in charge or being the boss of a department, and therefore the entry-level dietitian often believes that he or she does not need to be concerned with knowing how to manage. In reality, all dietitians, regardless of their job title or job responsibilities, perform many managerial functions and need to develop managerial skills. The clinical dietitian, the food service manager, the nutrition in community nutrition program, the educator, the private practitioner, the dietitian in business and industry, and healthcare administrators all perform management functions. Among these functions are setting goals, evaluating outcomes, managing resources, integrating and coordinating personnel activities, training personnel and allied professionals, communicating and promoting quality control. Management and leadership have many overlapping characteristics and have been described in several ways by leaders in the management field. A simplified way to view them is to think of management as the activities that go into making a department or an institution run, doing things, and leadership as the qualities a person needs to possess in order to make things go right. We could say things are managed and people are led. What are the various management functions of dietary department? The following are the management purviews. One is the planning. Planning is the activity of setting goals and objectives. The extent of the planning from setting broad, long-term goals for a large organization to planning short-term goals will usually be determined by where persons are in the organizational hierarchy. 2. Organizing. Organizing is the reflection of how the organization accomplishes its goals and objectives. The task to be performed, assignment of tasks, allocation of resources, and flow of authority and communication are established. 3. Coordinating. Coordinating involves activities that lead to an efficient use of resources to attain the goals and objectives. 4. Staffing. Staffing means determining human resource needs, then recruiting, selecting, hiring and training the necessary staff. And 4. Directing. Directing for leading refers to these activities that enable accomplishment of the organization goals, that communicate those goals and that create an atmosphere that encourages commitment and desired performance. Controlling. Controlling occurs when performance is assessed against a standard that have been translated from the goals and objectives and corrective measures applied as needed. Dietitian. When our experience in management areas of practice are aware that oversearching all those activities are the need to communicate effectively, realizing that this is always a two-way process and to develop the ability to work in productive ways with others in the organization at all levels. Setting goals and standards, incorporating as much technology as feasible and needed, and being financially astute are all critical to successful practice. Skills and abilities of dietary managers. There are three types of skills known as human relational skill, technical skill, conceptual skills. It varies according to the level of hierarchy. Every managers need all the three skills to fulfill their role requirements, but the relative importance and the specific types within each category depend on the leadership situation. Directors of food service commonly use the organization chart as a means of explaining and clarifying the structure of an organization. They also use job description, job specification, and work schedule as devices for the clear presentation of personnel and their responsibilities to top management and to employees. These mechanical or visual means are indispensable in the direction and supervision of food industry. Food service has been called the ultimate people business. A detailed plan of organization for a food service indicates the number and type of human resources needed, their work schedules, the provision made for their training, and the responsibilities assigned to each department. The skill, craftsmanship, dependability, and regularity of workers and their contribution to group morale may determine their selection as an employee of food service industry. The specific activities practiced in three skill areas are discussed in the following section. Human relation skill. The following are the various types of human relational skill. Interpersonal relationship. Now, what is interpersonal relationship? The ability to work with others towards common goals is the number one factor denoting success among healthcare multi-departmental managers. Communication. There is better communication between clients and the professional when there is a perception that the dietitian is the expert and can be trusted. Coaching and mentoring. A mentor is described as a person who teaches through verbal instruction, demonstration of particular activities or skill, and role modeling. Coaching is similar in that it is used to inspire and motivate as well as teach. The successful dietitian may function in both these roles in order to accomplish needed tasks. Managing conflict. The dietitian who recognizes cause of conflict and assists in taking steps to overcome the differences will be looked to as a manager and leader. When dealt with quickly and constructively, conflict can be a way of improving performance. Networking. People form network for sharing social and business information and to increase professional competence. Sharing information is vital in any organization, and the manager will seek opportunities to network both within and beyond the work unit and will encourage others to also network. Technical skills. Technical skills are those that require a specialized knowledge of techniques, methods, procedures, and process that accomplish the work of an organization. Knowing how to access and use technology for communications is a must for all professionals in the modern workplace. The following technical skills are as follows. One is the job skill. The manager has knowledge of what is required of the workforce to perform in an organization but does not generally perform the work except on an as needed basis. Resource management. The importance of including financial management in dietetics program is emphasized by dietetics program directors. Benchmarking is a process by which the manager can measure the efficiency of work, the products produced, and the services for comparison and improvement. Training and staff development. The responsibility for hiring and training personnel is primarily that of upper level management. However, all professionals will at times help train and develop new employees or other professionals. Team building. A team function in ways that support individuals' efforts and leads to greater productivity. The value of team lies in sharing knowledge and working towards common goals using the experience and expertise of several people in decision making and problem solving. Quality management. Quality management is often defined as meeting standards and expectations, sometimes in terms of high quality or above a norm or average. The team members of group interact with the scope of practice framework committee, the evidence-based practice committee, and the nutrition care process committee. Conceptual skill. The manager performs a certain number of activities based on visualizing the larger picture beyond the technical aspects of his or her position. The following are the various conceptual skills. One is strategic planning and goal setting. Strategic occurs at the upper levels of management as it requires data gathering and analysis, development of strategies, goals and objectives, and implementation of action plan. 2 is ethical conduct. The code of ethics for the profession of dietetics is the guiding document to ethical practice. The manager or leader assist in developing organization practices and policies that promote ethical practice. Managing change. Change occurs when there is a dissatisfaction with things as they are and there is a desire to change them. Change may occur slowly or rapidly as in the event of sudden and or unplanned circumstances. dietitian who counsel client to make change do not always meet success. Organization structure in dietary department. The organization function deals with all those activities that result in the formal assignment of task and authority and a coordination of effort. The supervisor, staff, the work unit trains employees, secures resources and empowers the work group into a production team. The steps in the organization process include: 1 is review plan, 2 list all tasks to be accomplished, 3 divide tasks into groups. One person can accomplish a job, groups related job together in a logical and efficient manner, assign work to individual, delegate authority to establish relationship between job and groups of job. The nature and scope of the work needed to accomplish the organization objectives is needed to determine work classification and work unit design. Division of labor. Work specialization is the degree to which tasks in an organization are divided into separate jobs. Work process requirement and employee skill level determine the degree of specialization. Placing capable people in each job lies directly with productivity improvement. In order to maximize productivity, supervisors match employee skill level with task requirement. Supervisors should perform workflow analysis to examine how work creates or add value to the ongoing process in an organization. Workflow analysis looks at how work moves from the customers or the demand source through the organization to the point at which the work leaves the organization as a product or service to meet customer demand. The workflow analysis can be used to tighten the connection between employees' work and customers' needs. Also, it can help to make major performance breakthrough throughout business process re-engineering, a fundamental rethinking and radical redesign of business processes to achieve dramatic improvement in cost, quality, service and speed. EPR uses workflow analysis to identify jobs that can be eliminated or recombined to improve company performance. Next, we can see financial planning in dietary department. Financial planning and management are essential for the success of every food service operation. Knowledge of the techniques used to control cost and to provide data for sound financial decision making is a must. Setting goals, knowing the accomplishment, evaluating progress and taking corrective measures necessary to bring operations in line with the set goals are few actions to achieve basic financial maturity. Management Information System (MIS) are networks of communication that provide management with information about the organization activities and serve as a basis for decision making. Food service computer information system may be classified into 6 basic program categories: menu planning and analysis, inventory and purchasing control, production control, food cost control, sales control, labor productivity and payroll. Any successful information system must be well organized and developed on the basis of want and needs of the individual food service operation. MIS is a total process in which data are provided and refined to give desired information to management at all levels. To attain the goal, specific objectives such as what the formal information system is to accomplish must be stated and the information to be provided must be identified. MIS facilitates the management functions of planning, organizing, delegating, leading, and controlling. Management activities and dietary department. The dietary department performs two major activities, that is nutritional care of patient, food service management. Objectives and goals are reflected in formal plans. Plans draw out how objectives are to be achieved, when they are to be achieved, and who is accountable to achieve it. The dietary department, which consists of dietitian, has got a role in the decision-making system for patients' care. Dietitian not only cater to the patient's food requirement, but they are responsible for planning, prescribing, and counseling patients about their diet according to their diseased condition. Their functions are to maintain good nutritional status of all patients, educate patients about how diet plays a major role in the treatment of various diseases, modify the daily diet patterns of patients to meet their requirement during various disease conditions, to correct deficiencies, especially in patients with prolonged hospital stay like cancer patient and critical care unit patient. Dietary therapy in most instances is not a remedy in itself, but it's a measure which supplements and makes the medical or surgical treatment more effective. Human resources function in dietary operation. The human resource department is important to any food service operation as they are concerned with the very important resource people. The department is responsible for hiring, maintenance, and exit of staff. The following functions would concern for dietary operations: recruitment, that is to fill permanent and temporary vacancies. This became critical especially when additional staff is required during peak period in a day, week, or season. Their challenge is to feed the food operation with qualified people to meet the food operation. Second is orientation. It is provided to newcomers to help them settle into the organization and job at the shortest possible time. Training. It is a contribution to any food operation. The HR department will have trainers to develop skill and careers to the standard set by the organization. Payroll. The HR department also coordinates the performance appraisal process to ensure that performance are rewarded. It is an important function to ensure that salaries and wages are paid on time. Exist. Formalities are important to ensure that all dues to an visiting employee are honored as per labor laws. Revenue management in dietary operation. Segmented market. Markets are segmented based on a set of categories based on the price each category is willing to pay. Because demand patterns for each of these categories may vary, it is difficult to satisfy all of the demand simultaneously. Fixed capacity. This capacity is relatively fixed and flexible. If so, there would be no need to manage capacity. Perishable inventory. For example, in the hotel industry, hotel rooms are the inventory. A hotel room that remains unoccupied for a night loses all its value for that night. This inventory cannot be stored and is lost forever. Because revenue management tries to manage demand instead of supply, it proves to be good business sense for the hotel. Low marginal cost. The fixed cost is heavily capital intensive. However, the management has to cover its initial fixed cost. The cost of serving an additional customer is low enough so that it can sell the room at a lower margin. Advanced sales. More often, request for sales starts early. Therefore, they have enough ways to adjust prices based on the variation between sales and expected demand. If all are sold at the same time, it does not have the flexibility to adjust prices upward if demand picks up later. Demand fluctuation. Demand is characterized by crests and troughs. The factors include during the pricing process. In peak season, it can increase its revenues by raising price, while during the lean season, it can increase its utilization rate by lowering prices. Past data will offer the manager a way to forecast when these periods of high and low demand may occur. Revenue management is based on complex or optimization methodologies developed from advanced statistical and analytical models. In order to arrive at a solution, managers need to evaluate several millions of decisions, which requires a significant investment of skill, hardware, and time. Many revenue management practitioners prefer to break down the actual business scenario into font sub-problems and then identify an individual solution to some or all of these sub-problems. These 4 sub-problems are market segment identification, forecasting and pricing, inventory allocation, and overbooking. This would significantly reduce the number of potential non-optimal decisions, thereby providing fewer choices leading to quicker result. To conclude, as part of ongoing changes in the dietary department, companies throughout the entire hospitality spectrum are placing a strong emphasis on implementing major operational changes. Recognized meaningful cost reduction must be achieved without compromising safety, capacity, and service levels, reducing cost by increasing flexibility and improving asset utilization. It continues to reassess their true care competencies and are looking to outsource many of these processes to optimize business efficiencies and increase profitability. In this module, you should have had a holistic learning about management purviews of dietary department.